So this is what I understand about hearing so far. To be expanded on, but not yet. We're looking at hearing loss. So 2 types of hearing loss. We can have conductive hearing loss or sensory neural hearing loss. So conductive hearing loss occurs when there is problems transferring sound waves anywhere along the outer ear or the middle ear, and that includes the eardrum as well. And then sensory neural hearing loss. So this occurs if there is damage to the hearing apparatus, so your cochlea and that kind of, all the internal gubbins of that, or damage to the vestibulocochlear nerve, number 8, nerve 8. So we can put damage to, so apparatus, hearing apparatus, or cranial nerve 8. Okay, so that's sensory neural, and then conductive is what did I say? Problems getting sound waves in this part, the middle and outer ear. Yeah, so don't really know what to write there. I won't do anything. So it affects this bit. Right. Okay, so we've got 2 types of hearing, 2 hearing tests that we do. And one is the Weber's test and one is the Rinne's test. So what do we do in these tests? This is with our 512 megahertz tuning fork. So the Weber's test is where you put the tuning fork on the top of their head. So that is Weber's. So in the Weber's test, what you're looking for, is lateralization. Okay, so you're testing bone conduction here. So you're seeing if sound travels equally down the bone through to the middle or outer ear, is this area here. Okay, so all around here. This is spontaneous colouring in. Yeah, so you're looking for lateralization. So is the sound being heard equally in both ears, or is one louder than the other? So normal hearing in a Weber's test, it would be equal in both ears. Equal in both ears. Right, so if you have a conductive loss, yeah, so this is your middle or outer ear, the sound is loudest in the affected ear. Now this is the confusing bit, because you'd think that wouldn't be the case, hey? So conductive hearing loss is loudest in the affected ear. So there are 2 hypotheses here as to why that would be. So one is, if it's more difficult for the sound waves to get into the ear, it stands to reason that they're more difficult to get out, which would mean they're just hanging around and sounding in the ear, these sound waves. And also, because of the loss, there is an upregulation of the inner ear to compensate. So those are two hypotheses as to why that could be the case, that it's loudest in the affected ear for conductive hearing loss. If a sensory neural loss on a Weber's test, the sound is heard loudest in the normal ear. In the normal ear. Okay, so that's your potentials for your Weber's test. And then we can do our Rinne's test. Okay, now the Rinne's test, this is where you put the tuning fork on the mastoid process, then wait until they can no longer hear that, turn it around and pop it next to the ear canal and see if they can hear that. So what you're looking for there is basically air conduction should always be better than bone conduction, right? So if it's normal, once you've stopped hearing the sound on the mastoid process, you should be able to hear it when it's at the ear canal, okay? And that proves that air conduction is better than bone. That's normal. So, the results we can get for the Rinne's test, for conductive loss, yeah, bone conduction is better than air conduction. So bone conduction better than air conduction, right? So, and then if you are looking at sensory neural loss, your air conduction would be better than bone. So air conduction better than bone. There we go. Yeah, and so those are the results you can get. So what I've got here is so the Weber's test sees if you've got an issue at all, and then the Rinne's test will discern what that is, whether it's conductive or sensory neural. And that's all I've got for hearing right now.